But what we're going to do now is we have the whole ABBS founding board on right now, and I'm going to moderate this last session, and then we're going to wrap it up. I'm going to ask the first question here to those in the professional realm, which is Bryson, Ethan, and Ben. You guys work for a professional team, and the Major League team is starting in 1 week. Who's going to win the World Series? No, I'm just kidding. Let's ask you a different question, not a loaded question. We're biomechanists. You work for a team. What is your go-to way? How do you get this information out of your head to the athlete? And so Bryson, Ethan, or Ben, specifically, as specific as you can be, how do you get the information from biomechanics into something meaningful to the athlete and maybe the coach and the athlete?
So for me, it's about having the proper communication. A lot of times when we're doing these studies, we're talking in really high-tech terms that I can't expect a player coming to understand. If I'm talking about like the vertical ground reaction force or the ground reaction force in the Z or this vertical impulse, like you have to find ways to communicate with them. So the biggest part for me and doing any of our work with our players is showing them the data, but making it meaningful to them and giving them an easier way to look at it, not saying, oh, well, read the title of what this is and good luck figuring it out yourself.
Bryson or Ben, can you add anything to that?
Yeah, so I think, certainly adding on to what Ethan said, understanding the history of the athlete, who is the athlete, but also working with their coach, their skill area, pitching and hitting respectively, and understanding what the goal is and what they want to accomplishing, and tailoring your responses to make sure it's meaningful for that athlete. We can talk about generating a report, we can talk about generating the data. That's certainly great for us, but then there has to be another level of communication that happens there. And I think having prior context is the way to do that.
Bryson, you are the one who's been with the MLB team the longest in this group. So can you give us a specific example? You don't have to give the person's name, but I do want you to give a specific thing. You measured this on a batting. This is how it got there. You measured this on a pitcher. Can you give a specific example where you feel it was kind of a success story?
Sure. It might not be as specific as you want, but as Ethan laughs over there. So I think in one example, we had an athlete who may have been struggling with a little bit of command issue. I think we talk about velocity a lot. We talk about injury risk. So, touching a little bit on command a bit, and working with them and in discussion with the pitching coach that was working with that athlete and the coordinator, really putting together a plan and putting the piece together of, hey, biomechanics, we also need to recognize is only a piece of the information that we need to utilize, right? We can think, certainly, we think very highly of the data. That's why we're all here. But we need to know that it fits within a realm of other pieces of information. And so, in those conversations with the coordinator and the pitching coach, we were able to identify one or two things that we specifically implemented and said, hey, this might be something we want to track across time. And I think another thing we need to recognize is the metrics we pull out. Maybe that's what we track, but again, in your example of how do we communicate this to athletes, maybe it's something else that we actually work on to get the intended result, right? So we need to look at layers of meaning here. So, across time, we looked at something pre-post, and we're able to say, hey, based on these qualifying metrics of performance, based on what we were tracking from a biomechanics standpoint, this player was able to produce meaningful in-game results.
Okay, thanks, Bryson. I want to ask the other people on the panel about high school and adolescent pitchers or batters and how examples of how they've translated success or failure. But before I do that, I want to give Anthony the ability to answer this question. And Anthony, you're kind of on the bridge with a drive line. You can answer it about how you've worked with either a pro player or an amateur player, because you kind of work with both. So why don't you tell us how you might do it at Driveline, translating biomechanics?
Yeah, so I think it depends on how the athlete is kind of coming into us, whether it's like we're working with a team or an athlete specifically, or if it's just an athlete coming in to work with us. A lot of it, we used to, like the biomechanists directly, we used to meet directly with the players and talk with them, but we actually found that it was better for us as the biomechanists to communicate with the coaches or trainers and then have them work with the athlete. So we, taught the coaches and trainers that we have as much as we can about information that they then need to share with the athlete, because they're going to have a much better ability to communicate with them. They already have some built up rapport working with them. So we leave a lot of that up. And then a lot of the more like technical back end work we handle, and then try to provide like the roadmap that we feel is going to best optimize, their performance.
Very good, Anthony. So let me ask those who haven't spoken yet, which are kind of anonymous here, but I want someone to raise their hand for me. You have a high school pitcher or batter and mom or dad. You don't have the professional coaching situation. Can anyone tell us how, as biomechanists, we get information successfully implemented or at least the information across? A little story about anything like that.
Well, I was just going to say, as Glenn, you yourself can speak to, we do a lot of work with youth and high school pitchers. And usually, sometimes their coach is really interested and will come in, but often it is just mom and dad. And from the moment that we first have them come in, we ask them, what exactly is the goal for you to come here? Because they might only be here this one time, as opposed to with the teams, they may be working with them over time. And we'll try to see if it's a focus on increased performance, increased velocity, or injury risk. We also have, particularly with the high school and youth players, we have them take a pitch smart assessment to try to see some of the things that we've shown in our research are even non-biomechanically, but from clinical research, the number of innings they throw and just things that throughout the year. Do they play on multiple teams? Do they catch in addition to pitching? So we go through all of that, and then when we're doing our evaluations, we have a bunch of key parameters that we're looking at, things that we know are related to either performance or injury risk. And then the key there is we're not going to inundate them with numbers. These kids don't want to be in their geometry class. So we're very careful. We have high-speed video at the same time, and we want to explain exactly what we're seeing on the screen, as well as provide them both with not just the session, in-person session where we're describing what we found, but also something they can go back to, the presentation video record, as well as just in case they don't recall exactly what we said during the session. And it's this whole long process to try to make sure that anyone that is interested in this pitcher's success has this information.
Anybody else want to raise their hand? Okay, go ahead, Megan. You want to add to that?
Yeah, so I'd just like to go off of what John was saying, that as with all specialties, I think it's really important that to be able to really understand something yourself, you have to be able to tell a 2-year-old about it. You have to be able to explain it in the most simplest terms. And I think that individuals at ASMI, especially Alec, who I think is on the call tonight, we do a good job of demonstrating what we're trying to tell them. So instead of, as John said, just giving numbers or numerical values, we actually get up and we show them what we're asking. If it's shoulder abduction, we show them the angles that it should be. We tell them funny anecdotes so that they understand or try to remember once they leave the lab. And so I think that's one of the main keys in translating it, is to be able to speak their language.
And that's something that I'll reiterate what Megan's saying. Alec at the lab does a really good job of that, looking at it from a pitcher perspective. I'll bet Anthony could talk about that a little too. I know he's pitched at a high level, and that's important. Just speak their language.
Yeah, I
Okay.
just want to say that those are
Go ahead, Anthony.
really, really good points. And one thing we've seen is that as the athlete gets younger, the less they care about the graphs, the numbers, you know, the report. It goes completely out the window. All they want to do is look at like the actual 3D image of their mechanics, or they want you to like get up and demonstrate, you know, the motion. That's the only thing that they really care about, the PDF, those graphs, you know. And I think being able to speak the language is huge, and understanding the cues that help the most for an athlete. Like having experience and background playing baseball and pitching myself has been really helpful, just being involved in like knowing what kind of things that players latch onto. But across the board, it's never really words. I think the demonstration piece is a huge one. Like no matter if you can't figure out the right word or the right cue to get it across, just getting up and like demonstrating the movement is really valuable.
I just want to agree. I completely agree, especially the younger they are. The biomechanics data is for us, but the video and then the hands-on, there's nothing before coronavirus, there's nothing better than the hands-on to show what to do. And I think, yes, we're not there to share all the data. We're there to show whether video or hands-on what to be done. And the data is basically our credibility, but we don't need to impress them. We just that's just where we got this stuff from. Let me ask a question. This came in earlier from Dr. Jill McNick-Gray about what data visualization approaches are most appreciated by coaches. In other words, do they like looking at video, or do they like looking at coaches? Do they like looking at graphs or numbers or video? And you know, this could be for force plate data or IMU or motion capture data. What's the best way to get the image to coaches? Anybody want to talk about that? Okay, Matt, you want to? Matt, yeah.
Yep. So one of the things that we found, especially when working with coaches, is some of the older school coaches, the older coaches that are well established, they really like to see the video and then actually freeze frame at specific points that we want to talk about. And then we actually have the ability to draw on that image and kind of explain, you know, too much trunk lean, you know, arm slot position. Whereas some of the newer pitchers coaches tended to really like looking at the data and would get really involved in it. So we would take it as let the coach start to drive the conversation, and then where that went, we would go one of those two ways to make sure that they would really buy into what we were saying.
Okay, John, you want to add on that?
Yeah, I was just going to kind of echo that, but also say that it's kind of remarkable the things that you can see in the numbers that you initially can't see in the video. But then once you know what to look for from all of those numbers, you really can see in the video, like or especially things you can't see in real time that the coaches can't see. But once we find in the numbers, you can point it out and show it in the slow motion video. And really help illustrate the point. It really is a visual process of learning.
Thanks. Okay, Ben? Ben, you got yeah. Go.
Maybe I'm just having a different experience at times, but I'm going to lean towards more data to the player, the better. At least that's what I've observed. I think a lot of players have an appetite for it. That said, I like to lead with 3D animations, and the non-negotiables. What was the result of your pitch and your fastball, your off speed, are you tipping things? That alone, you can't debate the theory behind that. Are you tipping it? Yes or no? Are you throwing it hard? Yes or no? You have good command? Yes or no? Lead with that. I'm batting, same thing. Are you hitting the ball hard? Are you good in different zones? You have good launch angle, the batted ball stuff, ball flight, I think is the way to go to start. But when you get into, if you get some buy-in there, I think players really like to dig into how do I get the most velocity out of this, or how do I get the most power out of my swing? And there's nothing more, convincing than the graphs or numbers compared to a range, seeing how you compare to your peers. And at the highest level, I see guys that want every bit of detail. And you go to lower levels in past work. I mean, I'd say parents are probably more, no one cares about their kids more than their parents. Doesn't matter what kind of coach you are, the parents love their kids. And they want to see every bit of data they can. Now, getting that across becomes a challenge, but I guess I'm just biased towards wanting to give more, and I have faith that I think people can learn. I do have also faith that we can also overwhelm them, so it's a balancing act.
Okay, I do want to say, 1 second, Ethan, let me just say something. I do want to say that I hear your point, Ben. I'm still a fan of the visual and the video. I think when Rob Shapiro and I started, it was all about video, and that was the generation of the coaches were just coming up. It was the first time they were seeing video, and they were embracing it. But nowadays, I see your point, Ben, because of the ball tracking technology and the analytics in the front offices of the baseball teams, the players and coaches see the value of scientific data, which really gives us more of a foot in the door. Rob, do you want to have any comment about back in the old days when video was accepted or wasn't, and what the players thought when you first got into it?
Sure, except when I got into it, it was film, not video. So we were still using 16mm film because they hadn't developed the high-speed video yet. And I remember when we first showed a high-speed video to some of the White Sox players, they were amazed because they had never seen anything faster than 32 frames per second. And they were looking at hitting and pitching, and so the visual really helped. And our work at that time in the early 80s with the White Sox was only with the coach. I didn't talk to players at all. It was not my role. I was not a member of the team. I was a faculty member at a university coming in from the outside. So we just worked with the team coaches, and they loved to look at the film because they were seeing things that they had never seen before.
Thanks. Ethan, do you want to add something to this, or should we move on to the next thing?
Real quick, just looking at how baseball has transitioned, coaches are starting to get certifications. Players want to know more about their data. So it makes it a lot easier when we're talking about these things with them, because they're the ones going out and they're seeking this information. They're seeking this to learn. So that's one thing that I always talk to coaches about, especially in our organization, is if you're interested, go look it up, go learn about it, because then our conversations are much easier. So we talk about this, and we want to join together coaches, athletic trainers, everyone inside to learn about biomechanics. And a big way for us to communicate is for you to go out and seek that information. And it really helps our job, and it makes my job a lot easier when a coach comes up to me and asks specifically about like an anterior, posterior ground reaction force. You're like, oh, well, cool, here it is. And like going through an entire description. So that's a big piece.
Thanks. Okay, I got a question from my old friend Dave Fortenbaugh here. I'm going to read that, and then I'm going to move on to another question which was asked very big. So I'm just going to read Dave's question and give my answer as president here. This society is supposed to be for biomechanists. However, wouldn't it make more sense to invite coaches, front office personnel, or really anyone who wants to learn about biomechanics, especially if bridging the gap is the ultimate goal to make scientific data collection and analysis valuable? As a question to the panel, how much in-house training is there done to get everyone on the same page? Okay, so let me just answer this from a society point of view. Our vision for the society as a board is it's a society of biomechanists. And so the members of the society and the interaction is by biomechanists, but I agree, Dave, the audience should be everybody. And we had over 900 people sign up for this 3-day webinar, and it's not 900 biomechanists, okay? So I do agree. I'm very excited. I honestly thought we'd have 100 people sign up, and we had 900 people sign up. So yes, it's very rewarding. We're going to do, John's giving me a motion, over 1,000 people, I think, signed up, or 950. Anyway, yes, the society is the profession of biomechanists, but our objective is not just to talk to each other and slap each other on the back. Our objective is to talk to everyone else. I want to move on to a different question, though, for the panel, which is, we got into it a little earlier today about, are we as biomechanists trying to help improve performance or help reduce the risk of injury? And so at either the professional or the amateur level, does anyone want to raise their hand? Does anyone want to talk about any conflict or challenge, or are we trying to improve performance or reduce the risk of injury? Anybody want to comment on that? Matt?
So coming from the more medical side of where I worked, injury prevention was a huge aspect of what we did. However, that being said, injury prevention and performance pretty much are one and the same. If you perform optimally, there's less of a chance of being injured. If you are injured, you're not going to perform optimally. However, there is, as always, trade-offs between ball velocity and joint moments. And the fun part of our jobs is really finding that optimal solution to that problem. But in my mind, I think injury and performance are one and the same.
Gretchen, I see you shaking your head. Do you want to have any words to add to that, or just shaking your head?
I totally agree, because from a lab perspective, my number one is injury prevention. And if I can find those red flags so that the coach can intervene to correct those, then they're going to be able to be on the field longer and thus equal performance enhancement. So it's it's one and the same. Injury prevention. If you have injury prevention, you should be able to have performance enhancement because they're able to perform on the field longer and at a higher level.
Okay, I'm going to close this with kind of a fun, silly question that I'm making and throwing on you guys. You didn't know this. Tell anyone who wants to tell us about something that was either an embarrassing, funny moment or a scary moment that you did. For instance, back in the early days, we tested some baseball pitchers, and whenever a pro pitcher showed up, the computer would certainly break, and we all would sweat about it. But a little funny story is, I remember when my daughter was an elementary school kid, the whole class came by, and I brought them by, and we actually had a pro pitcher, I won't say the name or the team, who was being tested that day, and we arranged for the pitcher to pitch in front of the kids and the teachers. And this guy was a different bird, and he went to get ready, and I was talking to the kids and everything, my daughter and the teachers, and sure enough, this guy walks out ready to put the markers on. He's wearing tighty-whitey underwear, not leaving nothing to the imagination. That's all he's wearing, because he just wears shorts. And I'm like, oh my God. And I'm like, am I going to embarrass this guy and say, go to your room and put some real clothes on, or what am I going to do? So what I did was I said, okay, class, just for your safety, not to get hit from a ball, let's sit way over here. And then I had him pitch, and the staff and I acted like it was his normal outfit, and the teachers noticed, the lady teachers were noticing. But basically, I don't know what I learned from that, except maybe try to prepare and explain what people should do, what the subject should do. But does anyone have a silly story or a scary story of anything that ever happened to them as a biomechanist, things they don't expect happen sometimes? Raise your hand or make a gesture. Megan, Stewart, go ahead.
Mine, I guess it's funny now looking back on it. It was a little bit intimidating or scary at the time. This is more so for anybody out there that is still in school or studying or progressing. As mentioned on Wednesday, Dr. Shapiro was my master's advisor, who loves baseball, obviously, and did a lot of baseball research. And so my master's thesis was looking at kinematics and muscle activity. We had 6 different muscles. They threw fastballs and curveballs. They threw from the windup. They threw from the stretch. And so when I was nearing the end of all the data collection and I was starting to send drafts of my thesis to Dr. Shapiro, they kept coming back red, like all this red marking on them. And at the time, I remember thinking, oh my gosh, he thinks that I don't know anything about what I'm talking about. And then talking to him after and moving on in my career, I realized that that was one of the best things that he could have ever done, was to push me to be a better student and a better biomechanist. And it led me to further my baseball research. And so the point of this was that if you have that experience, like, don't get discouraged. It actually is very helpful and beneficial to you.
Thanks. I see Dr. Shapiro shaking his head, but good guy. Ben, you raised your hand. You have a story you want to tell and wrap us up here?
Sure. I mean, this is just stupid and simple, but we left the cameras out because who likes to set up cameras and take them down every day? But we left them out, and the sprinkler system on a field went off, and then it just soaked all the equipment. Total pain, but I think it made it through fine. But I'm sure there's got to be some others, but that's the one that came to mind.
Okay, I'm just going to let Rob have the last word there, then I'm going to wrap this thing up. The mean professor, Dr. Rob Shapiro, you're on.
The mean retired professor. So We were doing filming of the White Sox in Sarasota, and we were filming right-handed pitchers, and we would set up a 2D camera on the third base side to get the view of the pitcher striding towards home. And I forget which team we were playing, but Frank Howard was the third base coach, and the man was so large that he was very nice. He was standing right in the way of the camera, and I kind of waved at him. And if you ever was at the Sarasota field, there was like no room between the fence. And I mean, you're basically on the field when you're filming. And I said, Mr. Howard, could you move? And he looked at me, oh, sure, you're taking film? Okay. But no matter where he moved, he was so large that he was still in the way. I mean, he was just the biggest guy I ever saw.
Okay. Well, thank you, Rob. Okay, and on that, I think it's time to close. I want to close this by 7:30 Eastern time. And wow, what a great program. I want to really thank Bryson and John and Ethan for putting together this 3-day program. I told them before personally, our panel is clapping. I told them before personally, it was a wonderful combination of both academic presentations, but practical discussions as well. And I think that's really where biomechanics is. It's science, but it's also application. I want to thank everybody. These are our sponsors, of course, and their hyperlinks are on our website. And I want to thank them. They're going to continue to sponsor us. I want to point out, this is July. Next month, we're going to have an ABBS business meeting. And all biomechanists, please join us for that. It's going to be part of the American Society of Biomechanics, which of course is virtual. So check our website, about in our social media, because we want to form the society as far as bylaws and board members and things like that. So please come there. If you're not a biomechanist, yes, we are in partners with you, both these companies and people who work in baseball in different professions. And so please follow our social media. Again, these presentations, these communications are between biomechanists and others. And the purpose of the biomechanists is to be part of team players and work with everyone else. I want to thank everyone who presented tonight and on the 3 days. And I want to especially thank all the participants who've been here. And thank you and good night.